Almost 40% of people experience leg pain at least once every year. So it's extremely common. The most common cause of leg pain is muscle strain. It happens when a leg muscle is injured microscopically, when muscle fibers stretched beyond their normal limits, tiny tears appear in the tissue, and this causes inflammation. Usually it happens when a person increases physical activity, such as long walking, climbing stairs, or starting exercise after a long break. When you press on the area, there is clear localized spot of pain in muscle belly, not in the joint. The pain does not radiate sharply like nerve pain. It does not cause numbness or tingling. It also not deep and cramping like vascular pain. In moderate strain, pain may last 5 to 7 days. In severe pain and severe strain, especially with swelling or bruising, recovery may take up to 3 weeks. Treatment starts with relative rest, not complete immobility. Light walking is preferred. A cold compress in the first 24 hours reduces swelling. After that, warm compresses, warm showers improve blood flow and healing. The most helpful home care is gentle stretching, slow controlled movements, and gradual return to activity. The second most common cause of leg pain is delayed onset muscle soreness. It appears on the second day after exercise. People feel fine during the exercise, but the discomfort starts 12 to 24 hours later, peaks at 48 hours, and fades over 1 or 3 days. This is not dangerous. The muscle fibers are remodeling, calcium shifts inside the muscle and activate repair cells, and tissue becomes stronger. This is why soreness fades on their own and why repeated training reduces it. The third most common cause of leg pain is sciatica, affecting about 5 to 10% of adults during their lifetime. The sciatic nerve is the longest nerve in the body. It starts in the lower spine, passes through the buttocks, and travels down the back of the thigh and leg. When irritated, pain spreads along the path. This traveling pain pattern is hallmark of sciatica. People describe the pain as sharp electric shooting or burning. It often appears when standing up, bending forward, or sitting too long. The most common cause is lumbar disc bulge or disc inflammation pressing on the nerve root. Pain often starts after heavy lifting, long sitting, twisting, or sleeping in poor posture. In mild cases, pain lasts for several days. In moderate cases, 2 to 4 weeks. In most people, it gradually improves as nerve inflammation decreases. The first step of treatment is gentle movement. Complete rest worsens sciatica. Light walking is best. Non-steroidal anti-inflammatory medications can reduce pain for short-term use. The fourth most common cause of leg pain is osteoarthritis of the hip or knee, affecting 20 to 30% of adults over 50. Pain is described as deep ache around the knee, joint, or groin, spreading into tight during standing, stairs, or long walking. The pain is not sharp, but deep and heavy. The cause is cartilage thinning and bone surface sensitivity. The hallmark is morning stiffness under 30 minutes and pain that increases with activity but improves with short rest. People feel weakness or instability, especially when going downstairs. Treatment focuses on muscle strengthening, weight control, warm heat, and simple pain relief when needed. A fifth most common cause of leg pain is varicose vein and chronic venous insufficiency. It affects around 15% of adults. Pain is described as heaviness, burning, or throbbing, mainly in the lower legs. Worse after long standing and improves with leg elevation. The sixth common cause is tendon inflammation, especially in Achilles tendon, quadriceps tendon, and hamstring tendon, affecting 10 to 15% of active adults yearly. Pain is sharp, localized, point, worse with stretching or activation. The hallmark is tenderness directly over tendon and pain that improves slightly after warming up. Treatment is based on slow stretching, eccentric strengthening, cold after activity, and warmth before movement. Recovery usually takes 1 to 3 weeks. The seventh cause is muscle cramps, affecting almost 60% of adults yearly. Often at night, pain is sudden, intense, tightening. The main cause are dehydration, electrolyte imbalance, long-standing and sudden exertion. The hallmark is visible muscle hardening, stretching, hydration, magnesium intake, and warm shower help prevention. The eighth cause is shin splints, common in runners, affecting around 10%. Pain is dull ache along the shin bones, worse with activity. And ninth cause is hip bursitis, affect 10 to 15% of adults, mostly women after 40. Pain on the outer hip, spreading down outer thigh, worse when lying on the side or standing from sitting. The hallmark is local tenderness over outer hip. Treatment includes warm compresses, gentle stretching, and pressure avoidance. And the 10th cause is peripheral neuropathy, affecting 8 to 10% of adults over 50, especially in the case of diabetes, vitamin B deficiency, and chronic alcohol use. Pain is burning, tightening, numbing, or electric shocks, often at rest at night, starting in the feet and moving upward symmetrically. Treatment focuses on correcting the causes, vitamin B replacement when deficient, nerve calming medications. Early recognition prevents progression.